Hi, my name is Andrew Geddert. I've been practicing herbal and nutritional medicine for 35 years, and one of my specialties is IBS. So I've treated thousands and thousands of patients. I've also written a book called Healing Digestive Disorders, as well as done research in university settings on digestive disorders. And so today we're going to answer commonly asked questions about IBS. If you have a question, please put it in the comment box and we'll get to it on our next video. What is IBS? So they consider IBS a functional digestive disorder, and that generally means that there's no lab tests or no microscopic examination that can say that you have IBS. So it's a functional disorder, meaning you have certain symptoms, and the typical symptoms involve some kind of digestive pain or such as bloating, and then it may involve constipation, may involve diarrhea, or maybe a combination of diarrhea and constipation. So what causes IBS? We don't really know the actual cause in Western medicine. In Chinese medicine, we talk about how genetics is really important. You pass on your qi from your ancestors. And many of us have noticed that some people, lung conditions run in their family. Other families, heart conditions run in their family. And then some people, digestive problems run in their family. So we find that oftentimes people with IBS have relatives that also have IBS. So it's thought of a genetic predisposition, but then there may be some kind of stress. It may be environmental, it may be a food stress, it may be an emotional stress that kind of can trigger the whole thing. So in my opinion, it takes genetic predisposition as well as some kind of offending stress, whether it be emotional, mechanical, such as trauma, or psychological. So what are some of the treatment options for IBS? So in Western medicine, one of the things they like is fiber. One of the problems that I have with the fiber products that they administer is there's too much sugar and sweeteners. And these fiber supplements are usually based on grains, and some people are allergic to those grains. So in terms of natural medicine, we try to go away from grain fiber to fresh fruits and vegetables, which have natural parts of fiber. In Western medicine, they talk a lot about stress reduction in the form of meditation, and they do recommend that people that have IBS, that they're under a lot of stress, might consider talking to a therapist or a minister, somebody who can help them process their feelings. And then Western medicine has some drugs that stop diarrhea, that treat constipation, or help with the overall nervous system. And in general, these stress reduction works really well. Exercise works really well. The drugs don't work very well for IBS. I think that you can manage your IBS symptoms by looking at your diet, and generally it's eating a healthier diet. One thing that's really big in my practice is avoiding alcohol, sweets, and sweeteners. And so I've had countless people that have chronic indigestion, chronic IBS, chronic digestive problems. Once they stop or greatly reduce alcohol, sweets, and sweeteners — alcohol, remember, is just a sugar — their digestive system does much better, and in some cases they're actually cured. So I used to get this confused. There's IBS, which is irritable bowel syndrome, and there's IBD, which is inflammatory bowel disease. And so I used to get these confused a long time ago, even once in a while now, natural therapists get them confused. They think that, oh, Crohn's or ulcerative colitis is just a more severe type of IBS. It's a totally different disease. So in general, people with IBS or irritable bowel syndrome may have stress or may eat some food and have symptoms, but the laboratory tests are normal. People with IBD or inflammatory bowel disease, and this is generally considered Crohn's disease and ulcerative colitis, generally they're considered an immune modulated condition, autoimmune conditions. And so that there are immune parameters, and they can also diagnose Crohn's disease and ulcerative colitis by using colonoscopy and other diagnostic measures. In summary, I believe you can treat IBS if you're prepared to look at your diet, have a daily stress reduction and exercise program, are willing to try simple remedies, and if you're not getting the results, see a natural health provider because they can provide more personalized advice for your IBS. If you'd like to see more videos like this, please be sure to like and subscribe. This would really help us grow our channel. Thanks for joining us, and we'll see you next time.